This is CBS 6 News in high definition.
New at 6 tonight, we now know who will be fighting to take care of you. New York State has approved rates offered by insurance companies to be entered into a health care exchange as a part of the federal Affordable Care Act. Matt Markham is here now live with us to break it all down for folks at home, many of whom had been waiting to hear this news for a long time, Matt.
That's the truth, Dory. The wonder for so long was what the plans on the exchanges would look like, or at the very least, cost you, and that's especially true for one woman we first visited last year on the day the Supreme Court ruled in favor of the Affordable Care Act, and we went back to check in with her again. A lot of people find this whole process confusing. Is it confusing?
That's why I'm just sitting waiting for a packet, because I don't know where to begin.
Isha Gay is uninsured now and is hoping to find premium rates under the Affordable Care Act truly affordable. Are there things that maybe you would have gone to the doctor for in the last year that you have not gone for because you're waiting for insurance?
Yes. My blood pressure, it seems to go up and down, and I know I need to be on medication, but I can't afford the visit, let alone the medication.
Now Isha will check up to the rates on New York's exchange. 10 insurance companies will set up shop for the Albany area. CDPHP is one of them.
We're ready to compete. Looks like others are as well, and we'll see. You know, it's up to the consumers in the end.
The exchange will open in October. Coverage will kick in January 1st of 2014. The rates set and approved by the state are broken down into 5 tiers.
The metal tiers break down by comprehensiveness of care and cost of your coverage.
According to the governor's office, individuals who buy insurance will save more than half from rates last year on the average.
Can people now go online to look at all this and basically start their shopping now?
I think it gives them the beginning of a tool to compare plans.
Companies offer plans which range in monthly cost from just over $500 to $900 for the highest tier, $418 to $743 on the gold plan. Silver selectors would pay between $342 and $615 a month. Bronze would cost you even less, between $270 and $526, but the lowest level, called catastrophic, is offered by 8 providers locally. That includes CDPHP.
They don't need to make a choice right now. They have some time, and there will be even better comparison tools starting October 1st.
Good news for Isha, waiting for a remedy of her own.
Spending for a doctor's visit out of my pocket, I could be putting meat on the table. Like, I don't get food stamps. I don't get any of those things.
All right, guys. Well, coverage does begin on the first day of 2014. Health insurance companies say, as you might imagine, they've never really been clamoring to get something done so quickly, because really, when you look at the whole thing, the timeline to get this done is really very, very short.
Yeah, time's ticking here, and we're talking about the penalties that are much lower than the rate. So I guess what's the expectation here with people who might go with the penalties?
Well, it's possible because, you know, the first penalty for the first year is $95, and then it goes up by 2016 to almost $700. So it's a wonder if people are going to risk it. It is a lot cheaper to take the penalty, but hospitals, insurance companies really don't know, and they're not going to know until people start enrolling for this on October 1st. So that gives them only a handful of months to really figure all that out.
Gives us a lot to follow in that time.
Yes, it does.
Certainly does.
All right. Thank you very much, Matt.